Almost 17 months into the pandemic, face masks have been one of the topmost measures implemented by individuals in order to protect themselves from COVID-19. However, the masks only act as a shield which, if not worn properly, can easily be rendered useless. But imagine a mask that is not only a shield, but it protects you from COVID-19 viruses by killing microbes on contact, thereby assuring 100% protection from COVID-19 virus. Well, imagine no more. A medical doctor and scientist here in the country have invented such a mask by using nanotechnology to treat the exterior part of the mask in order to kill microbes on contact without necessarily harming the individual wearing the mask. Our health and science reporter Zainab Mohammed met up with the young innovator and has prepared the following report.
Young, smart, ambitious and reserved 30-year-old Joseph Nderitu is a medical doctor, a scientist and an innovator. Dr. Nderitu is a nanotechnology enthusiast and the founder of the Tira Nano Lab here in Nairobi. After trending for about a week on social media for his contentious invention of a mask that can protect the user from viruses causing COVID-19 through the use of nanotechnology, I sought out to meet Dr. Nderitu in his lab to learn more about the famous nano masks. But before delving into how the masks work, I first wanted to understand what the technology that almost sounds like witchcraft is all about.
Nanotechnology it's a science of manipulating materials at dimensions that are 1/1000th of a meter. That's a very, very small scale. It's at the atomic level, basically. The reason why this is important is you can then draw benefits, materials that would ordinarily be useless or which may not have medical benefit in my case, become much more powerful, much more flexible and much more beneficial and potentially much less dangerous to human cells than they would ordinarily be in the grander scale.
According to Dr. Nderitu, having dedicated his life's work to the nanotechnology, it was only logical to implement it in the manufacturing of masks at a time when the entire world, and specifically healthcare workers, were at a high risk of contracting the COVID-19 virus.
When COVID-19 came and all of us are using these masks, as doctors we're using the 95 masks, we are using 2 masks, we're still getting COVID-19. It's not a very good experience. And while everyone else was running home to work from home and hide away from COVID, we were going towards the disease. And so it gets me thinking that, wait, maybe what we have is not perfect. Obviously it's not perfect, we're still getting this disease, right? It's not protecting us altogether. So the thing that I did at that time is I realized the work that I had been doing slowly, I wasn't very serious. Maybe now I should just take it very seriously. And that was the time when I actually submitted the materials that I had to the Ministry of Health, the National Microbiology Reference Laboratory, and they tested and verified and gave me a validation report. And from there now started the journey of trying to actually manufacture a nano mask here.
A mask that was created for health workers alone slowly grew into an idea viable for mass production. But how is a nano mask made?
Nano mask basically, like to describe it, the term, the nano, the prefix nano, it's a mask basically. Like that, you can call it a face mask, a surgical mask. So the prefix nano describes the material from which it's built. It's constructed from an antimicrobial nanocomposite nanomaterial, you may say, which is a fabric which is impregnated with antimicrobial nanoparticles. This is a fabric which in itself has the ability to destroy the viruses, bacteria, and even fungi, for instance.
The mask that took him approximately 7 months to perfect has now been worn with close to 100 people, going for about 500 shillings a piece, with a durability of about 100 washes.
We came up with is very durable. Is very durable, polycotton material, and when it's impregnated with the nanoparticles. Now, what results as a nano material is much more durable than if the fabric had not gone through the treatment process. In terms of the durability of the antimicrobial strength, it's supposed to be for the life of the fabric. That's the scientific prediction should be, and but because of consumer safety and strength in science, we would say nothing is 100%, nothing is perfect in science. So you give it a decay rate of say 0.1% for every wash, and that means that every time you wash it, you're probably reducing the strength of your protection against these viruses and bacteria to a certain degree. So for this one, I've given it up to 100 wash cycles, and that is whether it's machine wash or hand wash.
Almost 11 months into his production, Dr. Nderitu can't help but grin at the overwhelming number of positive feedbacks he has received from people who have purchased the masks.
This patient comes complaining about skin peeling and eruptions and basically allergy from the surgical masks. And so the doctor said, look, there are these nanomasks that we're using, and there's this doctor who's producing them. Maybe you should get them. And I think she got them somewhere around March, and the feedback that she gave later, I didn't know her. I had never met her basically, but I think we talked somewhere around June, and she gave this incredible story about how the skin peeling stopped, how the eruptions stopped, and the infections that they're like pustules or things like that on the face. It stopped, and she hasn't had any problems with her face since.
However, despite his successes, Dr. Nderitu has not been spared by the doubting Thomases locally and internationally, many trolling his work online and others approaching him personally to question whether or not his invention works.
I had a conversation with a European journalist who, I don't know whether he was recording stuff, but it was a discussion on that how can you even have the audacity to make this kind of claims? How come that we don't have someone in France who is trending after making nanomasks? How come you understand that? Why from Africa? Why from Kenya? Why not even South Africa?
A determined Dr. Nderitu says he's not about to stop for anyone, his plans being to perfect the production and designs of the masks whilst cutting costs in order to ensure the masks are not only available in the market, but they are pocket-friendly to achieve affordability.
I know that a medical device I have thought of, imagined, designed, developed, produced, and that has gone through clinical trials and everything, is out there in Ghana, in Nigeria, in Malawi, in Zambia, saving someone's life. There is no greater thing than that. And I hope that I can achieve it in the 5 to 10 years.
According to scientist and innovator Dr. Joseph Nderitu, nanotechnology, even though unexploited here in Kenya, it is the future of the 21st century medicine. Zainab Mohammed, TV47 at the Tira Nano Lab in Upper Hill, Nairobi.